Hazwan bin Zaini to recite the prayer.
Test. Al-Fatiha. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Ya Allah, Allahumma ighfir lana dzunubana wa liwalidina warhamhum kama rabbana shighara. Ya Allah, we express our gratitude to you for allowing us to attend the launching ceremony of conference online program on this auspicious morning. Ya Allah, we ask you for the safety of our religion and the welfare of our body. Oh Allah, Lord of the implanting authority, make the days we have gone through, starting with your mercy, continue with your blessing, and end it with thy forgiveness. And also make the days that we have gone through with guidance, and end with the victory of excellence. Ya Allah, let our efforts as a mean to enlighten or convince ourselves that the personal safety of either author or in a prerequisite for achieving happiness and excellence in various fields. Ya Allah, grant us faith and strength in order to face the challenge of life during the transition period and in the face of life in this new millennium. Ya Allah, show us guidance and adjust our paths and ways to achieve happiness and glory. Let us listen people who like the good things. Let us avoid doing the bad and evil things. Ya Allah, bless us our life in this meeting and gathering and prevent us from harm and fortunate event. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Walhamdulillahi rabbil alamin.
Amin, Amin, Rabbil Alamin. May our conference will going smoothly. Unfortunately, sorry to inform that Puan Malati Anak Perempuan Kararasinggam, Head of Department for Physiotherapy, can't join us today due to death of family members. We would like to extend our deepest sympathies to Puan Malati family. Next, I would like to invite Azlan bin Maknor as the President of Geriatric Conference, Batch 51 to give his speech.
Assalamualaikum and good morning to everyone. First of all, plethora of thank you to our beloved lecturers, my classmate, honorable judges, program coordinator, and online attendants who are watching this, and to all the person who helps in realizing this conference, including inanimate objects such as the internet line. As we know, conference is a tradition among ILKKM students. And as for physio students, usually do this on semester 5. However, since the pandemic be striking the whole world worldwide and changes our livelihood and the way we live up to the new norm. However, despite all of that, the conference still be going on, but we're doing it in online version. I hope all my classmates and all the person who are watching this conference will have an input, will have an interesting thing to know, to get to real life. Without further ado, let's start this conference.
Thank you, Azlan. Now, the time that all of us waiting for, the first group presentation entitled The Internet-Based Exercise Training, IBET, which is the current concept in osteoarthritis management with their supervisor, Puan Zuraida binti Muhammad. Please be welcome.
Okay. So, I am from the good one. First, Assalamualaikum and a very good morning to our beloved lecturers, respected supervisor Puan Zuraidah, my teammate, my fellow friends, and to all the audience. To begin with our presentation today, first, I would like to introduce my teammate, which is Nur Suhaili binti Muhammad Baki, Nur Majidah binti Mukti, Nur Farishah binti Safri, me myself, Nur Izzah Atirah binti Muhammad, and Tuan Azni binti Tuan Muhammad Zain. So today, I am Izzah and my friend Farisha, we will be presenting on our title today, which is the internet-based exercise training. I bet is the current concept in osteoarthritis management. Without further ado, okay, let's move on to the next slide. First, surely we want to know what is the knee OA. Osteoarthritis is a common form of degenerative joint disease. The knee is the principal peripheral joint affected, resulting in progressive loss of function, pain, and stiffness. It is estimated that approximately a tenth of the population aged over 50 years will be affected. As we can see here at the picture, we can see the difference between a healthy knee joint and osteoarthritic knee joint. What we can observe is in the OA patient, there is a degenerated of the articular cartilage. When it is degenerated, more friction is produced between the knee. And if the cartilage completely weighed down, the bone will rub on bone. This is the reason behind the pain and stiffness of the OA joint. For the next slide. Osteoarthritis change in elderly. We have a few theory of aging, which is the first is the wear and tear theory that state that human body age because it wear out over time. Second is the genetic mutation theory that state that aging is caused by mutation in the DNA of the cell. Third is the aeroquestostroke therapy that state that accumulation of aero in cellular molecule is the reason why the aging happen. The fourth is the free radical theory that state that aging is due to certain molecule and show violent when they encounter the oxygen. And last but not least is the programmed aging theory, which state that the cell has limited number of replication. This is all this theory basically will be the reason we have the factor why the risk of developing osteoarthritis will be more increased as you actually getting older. We may be common the other factor such as age, joint injury, gender, and obesity. But the cellular senescence is actually related with the program aging theory, which it actually state that cellular senescence as one of a factor lead to the risk of developing osteoarthritis, which is when the cell reach its limit, it will no longer duplicate. Then will actually be the risk of developing osteoarthritis. In general, all the theory can increase change of osteoarthritis because it reduces cell function and reduce joint stability. Why the epigenetic as one of the factor? Because epigenetic is a genetic alteration which eventually it will suppress cartilage function and lead to OA. Next. First, I want to introduce you to you what is actually the IBET program. Physiotherapy intervention has been shown to reduce pain, improve mobility, improve muscle strength, functionality, and quality of life among patients with knee OA. Unfortunately, rehabilitation will only started once symptom and disability is more significant. Currently, technology has become a current approach of connecting people to medical intervention, including rehabilitation as alternative mode in service delivery. For example, we may be familiar with Physio Mobile, e-rehab, and IBET. This is because the health professional begin to adapt with this rapid evolution of the technology and begin to deliver healthcare in a new way. Consequently, this tele-rehabilitation program became increasingly common as an alternative mode of service delivery. Tele-rehabilitation is defined as the provision of rehabilitation service at a distance using information and communication technologies. Next. What is the internet-based exercise training? Okay. The IBET program that used in this study was developed by the Visual Health Information and a multidisciplinary team, which is including the physical therapist, physician, and the patient. The program was designed with an aim of mirroring a real-life rehabilitation experience for patients with knee OA, including provision of personalized exercise recommendation, monitoring, and progression of activities. This means that services such as giving exercise intervention, tracking progress, consultation, education from health professional to patient all could be done using technologies like phone, laptop that is connected to the internet. Okay, next. What is actually the relevance between the IBET program in knee osteoarthritis? As we may know, patients with knee osteoarthritis may face a few challenges. First, surely in the current pandemic of the COVID-19, we want to reduce the amount of patients that coming to the hospital and limit our activities outside the house as we become at risk for the virus. Thus, IBET that is actually could be done at home is a better alternative. Second, this is also due to the current pandemic, therapists need to reduce number of patients and contact time with the patient. So, therapists actually enable to optimize the patient care for each of their patient. With IBET, therapists could focus and track progress of patient more efficient. Third, some patients may face the transportation problem as they need to take public transport or may ask their children to send them to the appointment. Actually, it will be a burden for the carer and will be a problem if the carer could not take them to the hospital as they will actually miss the appointment. With IBET, the consultation and treatment all could be done within the telephone or the laptop. What is because of the financial problem, coming to the hospital does surely cost some money. For example, money for the Grab or public transport, toll, gas money. IBET that could be done at home costs a lot of money. Fifth is also the environmental factor. Environmental factor could be a barrier for patients that living in the rural place as they could not get to the hospital as easily as the one who live at the city. As the personal factor, some patients do miss their appointment at the hospital because it may clash with other events or they have some other things to do. Okay. Moving on to the next slide, my teammate Farisha will explain further.
Speaker on.
Farisha, can you open your speaker, your mic?
Okay, IBET program. To make sure this program run efficiently, they combine this web-based training into STEP-NI OA. STEP-NI OA is known for step care intervention, which begin with low-intensity treatment and step up to more intensive treatment. This program has a three-step approach. Best exercise training itself, which is IBET, and the second step is the step 2, telephone-based physical activity coaching, and the third step is physiotherapist visit. So to describe it more specifically, step 1, which is IBET, that runs for 3 months, patient will get access to the website by using code. When they log into the IBET site, they complete a brief set of measures regarding their pain, function, and current activity. These include WOMAC, which is Western Ontario, and McMaster University Osteoarthritis Index. Based on this data, an algorithm is used to assign patient to one of 5 exercise level, which is beginner, easy, normal, hard, and very hard, that range in difficulty. Each of exercise level include stretching, strengthening, and also aerobic exercise. So, both of the exercise that patient need to do is displayed on the website and have static and animated version. Patient just need to click on the picture to animate the exercise, while there will be an instruction just below the picture of exercise. This will help them to understand and perform exercise correctly. Physio also can monitor their patient after every each of exercise. So patient is asked to record the exercise after every each of session. And physio can look after it. Patient also can move to difficult level only if their VAS and WOMAC score change and reduce. So, there are also pain monitoring, which is a patient asked to report any increases in pain as a result of their exercise. So this is the sample of screenshot from the IBET website. So we use this permission from visual health information. This is the example of the website. Okay, so they are also given weight adjustable ankle weight, which is displayed on the screen right now, and also the TheraBand. Okay, moving on to the next step is telephone-based physical activity coaching. Okay, this step is done for 3 months. So, patient with no improvement in WOMAC and VAS will be moved to step 2 and still get access through IBET. Meanwhile, patient with improvement will continue to access the IBET and has increased the exercise level. If patient will receive a call, and this call is guided by script and audio. The call are audio recorded. So, the goals for these calls is to know about patient difficulties and reinforce information, provide social support and benefit of physical activity. So the content of the first call is physio will the first content is introduction of physiotherapist role, and then physio will giving question to patient regarding about OA symptom, health problem or other challenges to their engagement in activity. So they also discuss and review about the exercise, and physio also giving description of SMART, which is specific, measurable, action oriented and time bound. And they also discuss about goal setting for the next 2 weeks. And there are open additional questions, so patient can ask the physio about their problem. So then the last step, which is step 3, is the physiotherapist visit. So the patient will move to the step 3 if there's no improvement in step 1 and step 2. So the intervention is based on usual physiotherapy care. This is 3. There are having in this step there is 3 to 7 follow up based on progress toward level. So the first session is just normally just like we always do in our department. Physio will do full assessment, and then they will also evaluate the patient need, like knee braces, bandaging, and insole. And this is all documented. So this is the Western Ontario and McMaster University Arthritis Index that used as outcome measure in this program. There include 3 items, which is pain, stiffness, and physical function. Okay. To understand it more clearly, we prepare a video. This program provides the same internet-based exercise training by using application known as Joint Academy. So,
Joint Academy is a digital treatment for chronic hip and knee pain. Since it's all in an app, you can access it when and wherever it suits you. Initially, you get a diagnosis from licensed physical therapist. This physical therapist will continuously follow up on your treatment and answer. Every day, you get exercises that are designed to your pain. They automatically adjust to you as you get better. Since your progress is logged throughout the treatment, both you and your physical therapist can follow your improvement from 1 week to the next. Joint Academy is there for you every step of the way until you reach your goals.
Okay. So for the patient criteria, the inclusion criteria is diagnosed with a patient diagnosed with knee OA and age 45 years old and onwards, and having complaint of knee pain for 3 to 6 months, and VAS is less than 5, which is moderate pain, and having early morning stiffness, less than 30 minutes, crepitus, bony tenderness, and has no palpable warmth. And patient also able to read and write and able to use or access to the computer, tablet, and have access to the internet. For the exclusion criteria is the patient with no internet access, diagnosed with rheumatoid arthritis or other rheumatic condition, and having severe fibromyalgia, gout and knees, and stable chronic obstructive pulmonary disease, also uncontrolled hypertension with diastolic blood pressure more than 110 or systolic 200 millimeter. And patient also can join this if there dementia and psychosis, severe hearing or visual impairment, and having TKR surgery, other knee surgery, a torn meniscus, torn ACL, stroke, heart attack, heart failure, or had surgery for blocked arteries in the past 3 months. And patient also cannot join this if they're participating in interventional study. So about the recruitment and enrollment and procedure, so the recruitment method, there are 3 steps, which is direct contact, which is physio itself will contact the patient. The second is self-referral. The patient will come to physiotherapy department, and the third is provider referral, which is doctor will consult patient to join this program. So patient are asked to come to physiotherapy unit for an initial visit, which consists of consent and baseline assessment, which is WOMAC, pain assessment, TUG, 30-second chair stand, 40-meter fast walk, and after the visit, physiotherapy would call participant. At that time, participant assigned to step knee OA, and they are given instruction step 1, which is website, and assistant with getting set up as a new how to use the website, and general information about physical activity and osteoarthritis. Next, moving on the next slide.
Okay, moving on to the next slide. Surely, I want to highlight here is actually the benefit of the IBAT. First, the IBAT is very time consuming as the patient do not have to go to the hospital. Second, it is very cost effective as it actually cut the cost of traveling and will not burden the carer, and they also can do the exercise at home. Third, it is easily accessible through online, and patient can communicate with the therapist using the technology. Okay. Fourth is it will improve quality of life. A study actually has proved that the IBAT do increase range of motion, reduce pain, and also increase muscle strength. Next, benefit of IBAT also is safety. As when patient do exercise at home, patient will avoid the communicable disease outside from their house. It is a home-based rehab, which is more easier and comfortable for them to do the exercise. 7 is interaction section with therapist, as patient can interact and ask questions to the therapist about the treatment easily through the app. Okay. Here is the evidence-based practice on the IBAT program. Narrow Hash et al. 2017 state that IBAT do decrease in pain and increase in physical function and quality of life, as well as decreasing fear of physical activity. She S. Hash et al. 2021 state that IBAT effective for pain reduction in patient with knee OA. Lorick et al. 2008 state that IBET improved 4 of 6 health status measure in patient with OA compared with usual care. Why? Lori et al. 2008 state that improve 4 of 6 health status measure in patient with OA compared with usual care. What is the Pickers M et al. 2013 state that IBET improve in the functional variables similar to those achieved in the conventional therapy group. Nero Hash et al. 2017 he stated that we in this digital OA management program reduce pain and medication intake, increase physical function and walking ability, and reduce willingness for surgery. Russell et al. And Tosignan et al. 2011, they state that similar health measure improvement when performed by physical therapists in person and video conferencing. Next. Okay. For the conclusion, IBET approach is recommended by Malaysian Physiotherapy as a different method in service delivery in order to optimize patient care. However, additional research is needed to identify best strategies for engaging patients with self-directed and mobile health intervention among Malaysian population. IBET also enhance patient empowerment toward the self-management attitude, exercise program, and strategies in their daily activities. And IBET improve social support since IBET is an interactive medium where patients can easily get access to their therapist for consultation. Okay, here is the appendix. We have the picture of demonstration of exercise from the internet-based program. You also. Here is the tracking of set-reported physical function from internet-based program. Here, the patient. Next. I think that's all from us. Thank you. If any of the lecturers or judges have any question, we will open for question.
Thank you, Group 1, for the amazing presentation. Now, question and answer session.
Okay, thank you for Group 1 for amazing presentation, new knowledge for our audience. Okay, first of all, saya nak terima kasih lah, okay, sebab kita boleh buat virtual conference even though ada some limitation. As a judges, first thing first, bermasalah adalah kita tak tengok body gesture lah kan. So kalau atas pentas kita boleh tengok body gesture, tapi kat sini macam susah sikit tak tengok. Okay. Alright, back to kita punya group 1 punya topik. About IBET IBET. So IBET, soalan saya, IBET ni special for OA case or it's for general? Means kalau general, how to make it more special for ni OA punya assessment and treatment?
Thank you for the question, Sir Bat. Okay. For us, we focus on knee osteoarthritis. So we search for the research only on IBET with knee OA. So we are not sure about others for the generals because we only focus our research and our slide on knee osteoarthritis for elderly. Thank you, sir.
So is there any macam mana as a physiotherapist kita boleh pantau ataupun kita tahu whether patient dan right exercise ataupun patient dan exercise tu secara betul atau tak. Okay, exclude daripada assessment from yang step 3 tu lah. So maksudnya in step 1 dan step 2, macam mana kita nak analyse patient, sama ada patient buat exercise tu atau tak, ataupun patient buat exercise tu secara betul ataupun tidak.
Okay, thank you for the question. Okay, sir. Just like we discussed just now, the step 2, which is there include, step 1, there include monitoring, which is patient patient need to record the exercise after they do the exercise. So physiotherapy can look after it. So physiotherapy can look after it, and if there's any patient cannot do exercise correctly, so they will discuss it just by the second follow-up, which is step 2, by through call, by call, and also they can check the patient directly. Yes, thank you, sir.
Can I highlight something here?
Fine, boleh.
Okay, first of all, congratulations on your presentation. Yes, it's a very interesting topic. What did Cik Bat say just now is about the compliance of the patient. Yes, the patient can record it. They can show you that they are doing the exercise. But how do you measure it? How do you know that they are doing the exercise? Is there any other way to record, or any other way that you can find out? You know, like what the strength.
Other assessment that
Is there any other
you
assessment
can be done to
ensure that they are doing that?
Yeah.
Okay, we understand the question. Okay, we try our best to give the best answer. Just like this, we can kita boleh tengok, sorry for the bahasa Melayu, kita boleh tengok melalui patient punya outcome measure berdasarkan WOMAC tu. Okay, in case anda kata kita bagi dekat patient dalam masa 3 bulan, untuk step first patient masih tak okay, so kita akan continue untuk step 2, telefon call. Dekat situ kita boleh tengok lah kalau patient ada buat kesilapan dalam dia punya exercise, so dia takkan ada peningkatan dalam dia punya WOMAC tu lah, dari segi dia punya pain, dari segi dia punya WOMAC pun dia akan, WOMAC akan meningkat, pain pun akan meningkat. So dekat situ kita boleh tengok bahawa patient tu dia melakukan mungkin dengan cara yang silap ataupun exercise yang tak betul lah. Sebab itu kita akan continue dengan step 3 dan kita akan perbetulkan balik dekat dalam step 3. In case kalau ada apa-apa kekurangan dari segi patient. Mungkin patient tak boleh tolerate dengan kita punya exercise dalam program tu, dan so dia lebih kepada kita kena try, kita cuba puan. Kawan-kawan ada tambahan?
Dari segi assessment okey, tapi dari segi compliance, maksudnya dia buat ke tak? Sebab kita dalam virtual ni, kita macam kita boleh fakekan benda tu kan. Kita kata okay, saya buat benda ni, dia akan tunjuk, dia ambil video waktu dia buat lah. Mungkin for example, takkanlah kita nak ambil video from the whole exercise kan itself kan. So dia akan ambil video certain exercise ataupun ambil gambar certain exercise. Tapi macam ni kita nak tahu dia punya tracking dari segi betul ke dia buat. Itu yang saya nak tahu. Ada cara lain sebenarnya, cuma saya nak tahu daripada pendapat kamu lah.
I believe carer also play role to actually monitor their parents to do the exercise at home. From there, we can actually ask the carer if they actually do the exercise. We can get an update from the carer.
Okay,
Setiap
saya buat
career, sir.
Okay, ya, Suhaili.
Sorry sir, interrupt. Setiap career dan kita punya guidance tu mesti nak yang terbaik kan untuk dia punya parents. So kita boleh consult dengan career tu waktu first visit dengan kita tu. So kita bagi career education so that career tu boleh bantulah untuk achieve the target. So mereka pun tak ada masalah dalam nak uruskan mereka punya patient tu lah, dalam uruskan mereka punya orang tua mereka. So lagi senang kita nak dapat target kita. Okay sir.
Okay, thank you. Tapi saya punya expectation lebih kepada kamu berfikir macam mana kamu nak settle benda ni ataupun kamu nak handle benda ni. So from my point of view is sebenarnya you boleh minta patient tu for example lah, paling mudah sekali kita ada fitness band kan. Fitness band ni paling murah lah. Okay, paling murah, dan minta patient tu pakai. Okay, and then set kepada free active exercise dan patient tu buat exercise dan dia akan bagi tahu bila. Contohnya pagi ni, tengah hari dan petang dia buat, for example. And then kita boleh minta dia screenshot ataupun hantar dia punya data from dia punya heart rate. Okay, so benda tu kita boleh tahu betul ke dia buat pagi tadi. So kita tengok heart rate dia, mestilah kalau dia buat exercise heart rate dia akan naik. Okay, so akan ada aktif kat situ. So dia akan buat tengah hari ada aktif kat situ. So bagi saya itu adalah cara untuk you nak analyse ataupun find out whether patient compliant for that exercise. So dia bagi tahu berapa kali dan you pun boleh tahu dan track is it true patient do the exercise at home or not, something like that macam tu. So you boleh identify dari segi certain exercise dan you boleh tengok dia punya heart rate how patient doing the exercise. Okay, so from my point of view lah. Okay, so ada tambahan daripada Puan Siti Khadijah?
No. Saya rasa macam dah cantik dah lah apa yang Cik Bat cakap tu, saya setuju. Cuma saya rasa awak kena, ni memang satu benda yang sangat menarik lah buat airbag ni kan, tapi cuma awak perlu aware tentang keadaan di Malaysia sendiri yang kita sebenarnya ada masalah dari segi penggunaan telefon, video di kalangan warga tua, which is bukannya mustahil tapi bukan mudah. And then internet access, okay, because memang kalau buat airbag ni dia memerlukan internet access yang sangat laju lah. So which is in the rural area especially, the internet access sangat limited lah kan. Jadi tapi itu di luar kita punya kawalan lah. Jadi cuma saya nak cakapkan sangat idea yang sangat bagus. Congratulations.
Terima kasih Puan. Terima kasih sir. Thank you so much for the idea. We will improve for the next time. Okay, now we will continue our conference. I would like to invite the second group with the title, The Current Intervention for Elderly Stroke, supervised by Encik Amirul. Please be prepared. Group 2. Welcome.
Assalamualaikum and good morning to all the online attendants, honorable judges, to my classmates, and to all the lecturers who are watching. I'm here from Group 2, which supervised by Encik Muhammad Amirul Aizat. I would like to introduce my teammate, Shaira Sakinah, Vivian Natasha, Tarshini, Parmaswaran, Nur Shahida, and our topic is about the current intervention for elderly stroke. Okay, to the next slide. A little brief history, trying to refresh ourselves with stroke. How does stroke, and there's two types of stroke, right? But how does it happen? It can be due to ischemic or the hemorrhagic accident. The ischemic itself, it is due to the accumulation of plaque or blood clot in a certain blood vessel, usually the branches of circle of Willis and the small blood vessel that are preceding it or succeeding it, once the clot taken over the small spaces, the blood supply is interrupted, and there will be a ischemic area that causes someone to get the cerebrovascular accident itself. And then the hemorrhagic stroke itself, it is caused by the formation of aneurysm, which is the ballooning of the artery. Once on the unlucky day, the balloon itself will burst or rupture, which cause a hemorrhage inside the brain, which will then cause a rise in the intracranial pressure inside the brain, thus causing the cerebrovascular accident itself. Okay, next. Next slide. Next slide. Next slide. Okay. Aira, ni kau punya ke?
Okay, we focus on the consequence of the stroke in elderly stroke survivor. The stroke disease increase with age, and it equal both men and women. 50% of all stroke occur in the people's age over 75, and the 30% of over age 85. Elderly patients are high risk of mortality, poorer functional outcomes, prolonged length of hospital stay, and institutionalization. Now we come to the consequence of the stroke, which the first one is muscle atrophy to the prolonged immobilization, and the second one is sepsis due to blood poisoning by bacteria. The third one is the risk of falls due to loss of balance in elderly, and it also can cause a fracture in elderly. Airway, the common airway disease on the elderly is pneumonia. The pressure sore is due to prolonged pressure on the skin, and the common skin that cover bony area of the body, such as heels, ankles, hips, and tailbone. Malnutrition will lead to the chronic illness, depression, and physical inactivity. Reduced functional independence, it can cause the elderly to depend totally on their family members or carer, and it can lead to the burden for their carer or family members. And the last one is socioeconomic family members affected. It can be seen through the financials when they have to pay for the hospitalization and medication. Next one is risk factor of the stroke is high cholesterol level, diabetes, high in fat diet, alcohol, obesity, high blood pressure, smoking, vascular malformation, and the last one is because of lack of regular exercise.
Okay. Okay. Since we're talking about stroke, a disease, right? There should be a measuring stick to anything. We need ruler to measure how long the distance of something. So for a disease, we need an outcome measure. So for in Malaysia, we usually use the modified Bartel index, which is the new one. The index itself used as a record of what patient does and can do instead of, and the need of supervision will render this. Let's say if things that is need to be done is need supervision, the score will be considered as not independent. The score itself is ranging from 0 to 100. 100 will be total independence, and 0 will be total dependence. Next slide. Okay, this is the index item in the modified Bartel index itself. It consists ranging from the incontinence issue, needs help with personal care, such as shaving, brushing your teeth, and then the score will be measured as and tallied as above as below. And then less than 15 usually represent moderate disability, and less than 10, the score, if the score is less than 10, will represent very severe disability. And then another next another outcome measure that we use for stroke is National Institute of Health Stroke Scale. This one is commonly used in overseas. And as you can see, this one is the scale is inverted. Instead of going for 0 will be the worst one, and the higher number will be the better one. This one is 0, is no stroke symptom at all. The higher the score will indicate a severe stroke, which is also the same to objectively quantify the impairment caused by stroke. Next slide. For this one, the NIH scoring, this is the item that are being used to assess. It's ranging from level of consciousness, from gaze, for visual field. Motor function is slightly divided here. From each of the upper limb and lower limb are separated, and then they even measure the ataxia, aphasia, and then the scoring not only being measured upon admission, it even measures throughout the progression of the patient itself, 12-hour and even 24-hour. What is TPA? Later on, we will explain what is TPA in this slide. Okay, for the next one is case study.
Okay, now we're going to look at case study. Patient's name Michael, age 61 years old. Current history, Michael experienced sudden onset slurring of speech, had facial droop on his left hand side with weakness in left side, upper and lower limb. Michael's wife spotted this sudden onset of symptoms and immediately called for an ambulance, which arrived within 15 minutes. For past medical history, patient has asthma, hypertension and prediabetes. For social history, patient is a workaholic planning on retirement in 1 or 2 years from senior partner in a law firm, lives in a bungalow with his wife Mary, who is a retired teacher. His hobby is playing golf. He is an ex-smoker, quit 3 years ago, and he is a social beer drinker. Okay, next. Okay, for investigation, CT brain and MRI has been done. For CT brain, hyperdensity in the right middle cerebral artery, and for MRI, demonstrated an occlusive thrombus extending from the right internal carotid artery origin through the right middle cerebral artery. Okay, for doctor management, TPA has been done. TPA full name is tissue plasminogen activator. It is a standard treatment for ischemic stroke and it is given through a vein in the arm. With the first 3 hours, it can be given up to 4.5 hours after stroke symptoms started. It is used to break up the clot that is causing a blockage in the flow of blood to the brain. Okay, next. Okay. Upon admission, patient's blood pressure is slightly high, but pulse is normal. For NIH score, it is 19 upon admission and 9 after 24 hours. Physiotherapy impression, left facial droop, slurred speech, and left motor weakness. Okay, next.
Okay, we come for the outcome measure. So I want you guys to focus on this outcome measure as it will be used in our clinical semester 5 and 6. For the first one is the Frankai arm test, a measure of upper extremity proximal motor control and dexterity during ADLs, which is activity daily living performance for neurological patients. The FAT is an upper extremity specific measure of activity limitation. And it have 5 tasks that have to be done by the patient, which is stabilize a ruler, grasp a cylinder, pick up a glass, remove a sprung, and the last one is comb the hair. Each item is scored as either pass, which is 1, or fail, which is 0. And the total score range is from 0 to 5. The next outcome measure that will be used for this patient is 5 times sit to stands. It's used to assess functional lower extremity strength, transitions, movement, balance, and false risk in the older adult. It is designed for adult range age from 18 to 64 years, and it can be used for the older adult, which is more than 65 years. And the interpretation is the lower the time, the better the score. For the physiotherapy management, we have the facial palsy exercise. The facial exercise will help to strengthen the specific muscle of the face and should be done 4 to 5 times a day in front of a mirror or as per advice of the physiotherapy. The mirror will also help to avoid letting the good side of the to be overcompensate by moving it in an exaggerate way. So the facial exercise are performed to keep your brain trained in what electrical impulse are needed to control different muscles in your face. The patient can use their finger to help with the movement if they need to and to move both sides of the face for the exercise. And the example of the facial palsy exercise are wrinkle foreheads, closed eyes normally, closed eyes forcefully, closed eyes on involved sides, wrinkles nose, blowout cheek, wrinkles, grins, and the last one is depressed lower lips. Other physiotherapy management for this patient is strengthening exercise. As we know, the patient have the left muscle weakness. So it's for upper limb and lower limb. Next one is functional activities such as sit to stand exercise. The positioning can be done for every 2 hours. And balance training and relaxation is such as Tai Chi and will be elaborated by my friends later. And the last one is breathing exercise such as pursed lip breathing as to tackle the asthma of the patient.
For the mind and body exercise Tai Chi, as we know, as a physio, we need to be very creative in our intervention. So one of it we can do for this patient is the mind and body exercise Tai Chi. It is proven that by Zhou et al. That mind and body exercise may potentially improve depression, at the same time activity of daily living and mobility of this post-stroke patient. Okay, next. Lagi ya. Okay. According to the benefit of Tai Chi and stroke rehabilitation in 2017, Tai Chi can help avoid fall by improving balance through dynamic motion and coordination. Meditation and mind-body exercise are effective to improve cognition of older adult age 60 years or above. High exercise parameters should be considered for intervention planning. This Tai Chi exercise able to strengthen the body, at the same time able to make our mind become better. So this is an example for the elderly. We do it in sitting. Tai Chi, as we know, is more emphasizing on the slow body motion. At the same time, very focuses on the breathing. So it very suitable for elderly patients. And this is me doing it in sitting. Because Tai Chi we can do in sitting, we can do in standing. For elderly, I think it's more suitable we do in sitting. Okay, next. This one is the advanced technology one. Maybe not available in Malaysia, but maybe available in the United States. This is called robotic hip, ankle, foot, exoskeletal orthosis. This one is almost the same with the treadmill exercise, but then the patient are being supported with harness, and then when the ankle over here have support with a robotic to ensure their leg are not supinated, and then it able to support the leg without foot drop lah. Next. Okay, demographic data. The mean global lifetime risk of stroke increased from 22.8% in 1990 to 24.9% in 2016. This we can see that the risk of death from caused by stroke is increasing from year to year.
Okay, once all the treatment done, this is a take-home message. for all the for the stroke patient, especially exclusively for the elderly. One thing that must consider is make sure the home is fall proof. What is mean by being fall proof here? Fall proof is mean by make sure any ledges or any stepper is being put any ram. Make sure the table, the sharp edges of table are covered. You can buy it in Mr. DIY these days. And then for my second point is less is more concept at home. Try not to make the home too crowded with all of unnecessary stuff. Try to declutter the home a bit, so that, let's say, you are taking an elderly with stroke, you want to bring a wheelchair, they want to use a walking aid. Make sure the home is clear, and then easy for them to manage around the home. And then take home message: just because the patient has a stroke they doesn't undergone for other medical checkup, right? The physiotherapy alone are not the main source of treatment for this kind of patient. Make sure try to have at least an SpO2 machine at home, or make sure all the nearby hospital or ambulance service are prepared in case of any fit or seizure suddenly attack the patient, since they are elderly, right? And then another take-home message that I like to emphasize here is place the patient in front of the large mirror regularly throughout the day, because sometimes, right, the mirror gotta be large, not small one, because the large mirror can stimulate their own perception of themselves. So, since stroke, they tend to have a body side neglect. Due to the neglect, they often forget which side they are affected. So if you put them in front of the mirror in a bright sunlight or in a broad daylight, instead of just a dull room where there's supine lying all day, so large mirror would definitely helps. And then enriched environment therapy for stroke, stated by Jensen H et al. This is a new treatment, a new kind of approach that's being researched by this researcher, which is going to the next slide. Enriched environment therapy itself is a technique used to cause an exposure to enriched environment is associated with significant increase in activity. From the slide itself, it's also okay. I just explained the point. It's decreased time spent inactive and alone, in sleeping, and active and sleeping. It encourage more time doing activity and quest solving, but this slide is not updated. Okay, technically, right, so it's something like this. When you go to the primary school or preschool, they usually have like some kind of toy, like building toy, or a certain kind of mini pack hold toys or exercise. So what we want to do here to encourage the stroke patient, try to make the home engage in try to make the home being more entertaining with a lot of activity. Let's say the elderly being put into let's say instead of they're sitting down all day, right, they try to place an object like a puzzle, or like a mini quest solving toy, so that they can use that thing so that they can engage in more brain activity, and thus improve their own social and cognitive impairment, instead of their become deteriorating over time. So
Next.
Next, okay.
Okay, well done for the reference. And this is one for from our reference. And last one is thank you. Thank you from our groups. And now we open for Q&A session.
So where is the MC? Where is the Madam Chairperson?
Me, madam.
Oh, okay. Can someone show me the first slide? I want to see the title first. I think I'm a bit lost just now with your presentation. Can someone please show me? So the topic given to you is current intervention for elderly stroke, which means that you have to focus more on the current intervention. Okay, but from your presentation, most of the slides explaining about the outcome measure. About 80% of it. Okay, you just explain about the intervention. I think about just 2 of it. One is Tai Chi. The other one is enriched environment therapy. Is it correct? Or did I miss any other intervention? So I think actually I'm a bit lost just now. So when we are saying about the intervention, I think your group should focus more on the intervention from the physiotherapy perspective. But most of the slide is more on outcome measure. And then can we go to the last 4 slides?
The last 4 slides.
Which start with the Tai Chi. Okay, the slide. Okay, so this is the first intervention, right?
Yes.
Is it? Oh, I missed one. Another one is the facial palsy. Okay, so Tai Chi is really good actually, but it's not. Yes, you can use Tai Chi as one of the method to improve patient with stroke, but it's just like what we can say, additional part, okay, for physiotherapies to add Tai Chi in physiotherapy treatment. Okay, so what are the meaning of the current intervention in stroke? Next slide. Just now you showed me about the robotic part, right? Okay, the robotic hip, ankle, foot, exoskeleton orthosis. These are one of the new intervention for stroke patient, which is really good if you can explain more on this part actually. Maybe you can focus more on this topic. Besides, another one is enriched environment therapy. Enriched environment therapy, which is I think is a new thing to me. Okay, so it's very good if you can explain more about this topic also. I'm a bit lost just now because suddenly we go to outcome measure and then we go to you explain about the case study. So I mean, overall it's okay, but a bit lost.
Okay, from my comment, same thing from judges Puan Siti Khadijah, same thing yang saya rasa, a bit lost also. The sequence of this presentation macam haywire sikit. Tapi macam Puan Siti Khadijah kata, you should focus more around 60-70% on this new thing. For example, yang kata ni lah, enriched environment therapy and the other one. So these two tu macam tak banyak explanation from you guys. So agak rugilah kat situ. supposed to be you kena explain more on that. Sebab kalau macam for Tai Chi tu macam kita dah biasa. So means the current intervention you should focus more on yang rarely used by physiotherapists among Malaysia especially. Okay, so kalau yang lain tu dah biasa. So you boleh explain but more on a new thing. So supposed to be yang dua ni yang you kena explain more lah. Tapi as a judges memang saya tak nampak kat situ. Okay, tak nampak you explain more for new treatment ataupun new intervention. Okay, alright. Itu saja from my comment. So tak ada apa-apa soalan. Sebenarnya nak tanya lebih pun susah juga sebenarnya. Okay, thank you.
Thank you.
Okay, just last question from me. Can someone explain me more about the enriched environment therapy?
Okay, madam. Okay, I want to explain about the enriched. Supposed to be right. There's an issue with the slide. Supposed to be the one with updated, right? The updated one, but the updated one is different just now. So I'm quite surprised too. Okay, and environment therapy. It's supposed to be by autism. It's supposed to be for child with autism. Encourage a plating that trigger the cognitive and the mental for the child. Let's say like simple stuff. There's a lot of other item, but I don't know what's the name. But I can give you an example. For example, Rubik cube, right? The child will identify the color of Rubik cube, and then the child will soon later realize, oh, maybe if I can get the color right, this thing will look nice or better. So what we try to do with Enrich is we try to put this kind of stuff on the table of the stroke patient. We try to do it for the elderly too, through toys. There's a lot of like hanging toy, like the puzzle with where you put key and then the thing is open here and there. So we try to place the elderly in an environment at home with this kind of stuff. Probably the toilet itself, right? The elderly, when they sit, suddenly they are like a blinking thing, and so blinking thing that are like, oh, please flush the toilet, like in Japanese toilet thing. So this kind of stuff will later, instead of a dull looking home where which is boring, so we try to make the home is more enjoyable, and more the home will be something like a learning place for, so that every day they will be engaged with a lot of activity that promote their cognition. So that is what is meant by enriched environment. Before the picture, I cannot find much, but from the name itself and from the research that we read, it is a type of treatment that for improve the mental well-being, the cognition lah, for the patient. Studies to
Is
animal.
there any evidence based that this enriched environment therapy is being used for stroke patients? Is there any evidence based? Because just now you mentioned that it is used for the autism, right?
So far there's a research here. Wait. Shida, yang mana research tadi ya?
Yes.
Yes, yeah, yes.
Okay, someone from the group, please help him.
Yes, in 2008, and the title is An Enriched Environment Increases Activity Instruction Undergoing Rehabilitation and Makes Rehabilitation Unique, a pilot one randomized control trial. There's a research about it.
So the research, so there is evidence based lah for this therapy.
Yes, madam.
Okay. I think it's a good. Okay. If you explain more on that thing, maybe we can give your extra bucks. Okay. I think okay. That's all from me. Thank you very much for your explanation. And congratulations.
Okay, thank you.
It's so interesting. Thank you to Group 2. Next is the presentation from the group titled The Roles of in COVID-19 among elderly, supervised by Puan Nur Hayati Harun. And please be welcome, my friends.
Yes. Okay. Good morning to our lecturers, viewers, and last but not least, my fellow classmates. As for our group, we will be presenting a topic on physiotherapy intervention in COVID-19 among elderly, a very new and hot topic at this moment. Before that, I would like to introduce our supervisor, Madam Nur Hayati Harun, my teammates, Muhammad Sharul Hazwan, Santania Hines, and Siti Khadijah. So without wasting more of our time, we will begin our presentation now. COVID-19 has caused an unprecedented pandemic across nations since its discovered in late 2019. Until now, no medication has been established by which the disease can be either cured or reversed. Physiotherapists are one key group working hard to help people throughout this pandemic, and it's a responsibility of the physio to provide total support for the patient whilst also protecting their personal health and safety in the service. According to the World Health Organization, WHO, from the article Coronavirus, the definition of COVID-19 is coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. As it is defined as illness caused by novel coronavirus, which we all know was first found in Wuhan City in Hubei Province, China. It was initially reported to the WHO on December 31st, 2019. On the March 11, 2020, the WHO has declared COVID-19 a global pandemic. According to Aaron Candola, 2020,
Sorry for interruption. Others, please off your mic. Santania, Sharul.
Shahira,
Yes?
turn off your mic. And then Marcella, turn on your webcam so we can see your gesture of presentation.
Okay, sir. Okay, can we proceed? Okay, according to Aaron Candola, 2020, from the article Medical News Today, COVID-19, the illness caused by the coronavirus, starts with droplets from the saliva or discharge from the nose generated when an infected person coughs, sneezes, or breathes. Next is by close contact with the person who has been infected. The coronavirus could be in the air or on the surface that we touch, then we touch our eyes, nose, or mouth. That gives the virus a passage to the mucous membrane in our throat. Thus, we get infected too. Next. Okay. As for the risk factor, we all know that all ages and both gender has the risk to get infected. But the most prone to get infected by this coronavirus is the elderly, which is our topic for today, the geriatrics. From the statistic according to the Health Ministry Institute for Clinical Research, COVID-19 death statistic recorded so far showed that 30.6% of fatalities involve those aged 60 and above. Looking at the comorbidity factor, more than 80% of the death cases involve those who are suffering from chronic disease, such as diabetes, high blood pressure, heart disease, high cholesterol, kidney disease, cancer, and liver disease. As comorbidity often increase with aging, the elderly population may have turn experience with severe with COVID-19 due to their pathophysiological changes. That's why the risk factor is high in the elderly because of the aging. Because the immunosense is referred to the gradual deterioration of their immune system as they get older. So next is where we can see here the death rate between male and female. Why sex-related issue in elderly patient? Male is more than female. This is because the male experiencing higher mortality compared with female. The localization of antigenesin, which is ACE2 enzyme, on the X chromosome raise the possibility of gender difference. So they will get infected more. Next is male has generate less robust immune system and more susceptible to the infectious agents. So that's why we can see here 72% to 28% of the death rate from male and female. Okay, next.
Okay, we'll move on to the pathophysiology. Okay, the SARS-CoV-2, which is received via respiratory aerosols, binds to the nasal epithelial cells in the upper respiratory tract. The main host receptor for viral entry into cells is the ACE2, which is seen to be highly expressed in adult nasal epithelial cells. The virus undergoes local replication and propagation along with the infection of ciliated cells in the conducting airways. This stage lasts a couple of days and the immune response generated during this phase is a limited one. In this stage, there is migration of the virus from the nasal epithelium to the upper respiratory tract via the conducting airways. Due to the involvement of the upper airways, the disease manifests with symptoms of fever, malaise, and dry cough. The virus invades and enters the type 2 alveolar epithelial cells via the host receptor ACE2 and starts to undergo replication. The host cells undergoes apoptosis with the release of new viral particles, which then infect the adjacent type 2 alveolar epithelial cells in the same manner. Due to the persistent injury caused by the sequestered inflammatory cells and viral replication, leading to loss of both type 1 and type 2 pneumocytes. There is diffuse alveolar damage, eventually resulting in an acute respiratory distress syndrome, ARDS. The inflammation of the lungs that leads to other physical changes such as pulmonary edema, dyspnea, tachypnea, and cyanosis. Okay, that's all. Next.
Okay, next. Some people are infected but not notice any symptoms. So there are signs and symptoms that shown to most individuals that may have infected with COVID-19. Okay, so most people will have mild symptoms and get better on their own, but 1 in 6 will have severe problems such as trouble breathing. The odds of more serious symptoms are higher if patients are older and have another health conditions like diabetes, heart disease. Symptoms usually begin 2 to 14 days after come into contact with the virus. Researchers in China found that the most common symptom among people who were hospitalized with COVID-19 include fever, fatigue, a dry cough. In early study have found that at least 60% of people will have dry cough, and then they will lose appetite, body ache, occur about shortness of breath, mucus, and phlegm. Okay, next. What is the treatment for all the people with COVID-19? So, okay. According to KKM, which is the Kementerian Kesehatan Malaysia, and WHO, which is the World Health Organization, older age has been reported as the risk factor for increased mortality in those affected by COVID-19. Okay, for those who with frailty are one of the most vulnerable populations. As we all know, that they have their own guidelines for the doctors to do their parts in COVID-19. First, it is recommended that older people should be screened for COVID-19 at the first point of access to the health system. Next, patients with mild COVID-19 should be given symptomatic treatment such as antibiotic for fever and pain, adequate nutrition, and appropriate rehydration. Next, and use cautious fluid management in patients with COVID-19 without tissue hypoperfusion and fluid responsiveness since it may worsen oxygenation. Lastly, blood plasma. A person that healed from COVID-19 has produced an antibody that may help to fight the virus. Hence, according to the chief medical officer of New York Blood Center Enterprises, Dr. Bruce Sanchez, through the transfusions of plasma from healthy individuals to those who are critical, the available antibodies will help the patient to fight infection more efficiently temporarily. Okay, next.
So, what is our role as a physiotherapy? So, physiotherapy will have a strong role in providing exercise, mobilization, and rehabilitation intervention to survivors with critical illness myopathies associated with COVID-19 in order to enable a functional return to home. So, the physiotherapy management for the elderly is oxygen therapy, where WHO recommends supplemental oxygen therapy immediately for patients with respiratory distress, hypoxemia, or shock with a target oxygen saturation more than 94%. So oxygen therapy will use yearly recognition and referral of patients with worsening respiratory function. So the oxygen therapy targets may vary depending on the presentation. The patient oxygen delivered via a face mask oxygen with receiver backflow rates recommend between 10 to 15 liter per minute. So that it gives oxygen at 24% with a ventilatory mass at 2 to 3 liter per minute. For high flow nasal oxygen, it has been found to be a beneficial at the early stage, which is from the China, with a select cohort of patients who present with hypoxemic respiratory failure. Flow rates are recommended up to 60% and 100% oxygen. So for ventilatory support, In continuous positive airway pressure, it is to help a person who has obstructive to increase air pressure in our throat so that airway does not collapse during inhalation. Second is bi-level positive airway pressure. It is to help a person who has chronic obstructive pulmonary disease to increase air pressure in inspiration. So this ventilatory support is it should be on ICU ward, intensive care unit. So it is depend on the situation. So there is a 4 stage of condition, which is early phase of COVID-19, acute phase, post-acute phase rehabilitation, and functional rehabilitation to return home. In early stage, patients are asymptomatic and mild symptom without significant respiratory. It requires a low oxygen requirement and less effective but non-productive cough. So for the physiotherapy intervention in this phase is no physical contact with patient to provide physiotherapy. However, advice on keeping active could be done via phone. Second is advice on daily moderate aerobic exercise, which is the patient can do brisk walking, jumping jacks, or jogging in the place. Or maybe the patient in elderly could do something light dancing. This is to let them freely from the boredom. So the next is design simple exercise poster, which is we can create a situation we give the cognitive rehab also, which is the patient can drawing, coloring, then we can do some indication for daily walk, stretches, strengthening, and balance exercise. Then it will be posted within patient rooms and ward. In acute phase of COVID-19, so in this ward, the patient is inadequate airway clearance due to inability to clear secretion due to productive cough but not effective from the respiratory tract in order to maintain a clear airway. So the patient on this stage increase in oxygen requirement, changes consistent with consolidation. So our intervention is so we can clearance the airway by positioning, deep, slow, and breathing. Then we can also do some percussion, shaking, and vibration. In ICU, acquired weakness, mostly in patients with comorbidities. For static quadricep contraction exercise, we can maintain or slightly increase strength of quadricep muscle. Because some of the patients are inactive and took a quite while in ICU ward, so the patient could lose their strength and muscle become worse. So example for static quadricep contraction is bed mobilities, which is straight leg raise, bridging, okay. Then low to moderate resistance exercise, which is the patient could do exercise with TheraBand or hand weight. Santon.
Okay, for the post-acute phase and functional rehab for return to home. So this is for patients which have recovered and are showing diminishing symptoms. What physiotherapists can do, what we do. So we can prop up bed in the ward, which allow the airways to be more stable and less likely to restrict air, keeping the spine aligned, reduces neck and back pain, which then lowers the chance of sleep apnea. So for the breathing exercise, we can do exercises such as thoracic expansion exercise, diaphragmatic breathing exercise, and respiratory muscle training to increase lung capacities and promote air entry. Next, physiotherapy can also demonstrate chair aerobic activities among the elderly, where they can use the chair as their support for stability and balance. This exercise can be done by grouping, and it was effectively help the elderly in physical and emotional. But we must make sure that we keep our distance and must use face mask or maybe if necessary full PPE. Due to prolong on the bed, it is important to improve balance and stability to prevent the risk of fall. We can to uh, tackle that, we can do static and dynamic balance exercise such as standing on toes, standing one leg with hands on the side of the bed or the chairs, and one side leg raised. Next, for the endurance training, it can be performed using ergometer cycle due to limited space because we cannot ask the patient to go running around the ward. So we suggest that we will use ergometer cycle because some ergometer cycle can be transferred from physiotherapy department into the ward. So physiotherapists can also perform neuropsychological training such as drawing, puzzling, coloring, and playing cards. In addition to diversifying activities, this also helps treat cognitive abilities in the elderly, in addition to prevent boredom because they have been staying for too long in the ward. So boredom is very is a must among them. Next, for the counseling session and psychological support, we must take note of the mental and emotional shown by the elderly. Ask them what they need, what they are experiencing, but be wise in dealing with depression. This is to uh, prevent depression among elderly. Family members are also given guidance to continue to encourage their family members, especially those infected with the coronavirus. Next.
So this is the video for the
As for the mental
exercise.
support in this pandemic area, we can see there are many cases of suicide. Oh, I think this is Sharul's side. Next, please. Sharul,
Yeah,
next
okay.
slide.
So this is a chair exercise video, which is the
Hello?
uh,
Hello? Sharul?
okay. Hello. Boleh dengarkan San?
Boleh, boleh.
Okay. Uh, So this is for the chair exercise video, which is the what patient can do in the grouping. Okay. So this is the case where we have been noted the increasing of the suicide cases in this pandemic era. We should note it and take the manage the patient who are in elderly who have the depression because of the negative and stress prejudice towards themselves. So the patient choose to commit suicide. So this is so that is important to us. Noted if there any sign and manage it so in professionally. On a conclusion, physiotherapy plays a crucial role in functional and respiratory rehabilitation. Hence, we should make use of this opportunity. So this is our reference. Right. Okay, that's all from us. Thank you.
Wow, nice sharing, guys. Thank you, Group 3. Now, I open the question for the judges.
Siti Khadijah.
Okay. Physiotherapy intervention in COVID-19 among elderly. It should be physiotherapy intervention in elderly with COVID-19. Please spell intervention correctly. Intervention. INTERVENTION. Okay.
Oh yeah.
Okay, so COVID-19 is a new thing to us.
Yes.
So your topic focus more on intervention. And you did your group did explain about the intervention for COVID-19 patients, especially elderly, especially on psychological part lah, psychological support. Can someone explain to me? Because most of the intervention shown here is a simple physiotherapy intervention that we use for other patients with other lung problem. So, but with COVID-19 is something new, something and most of the patient, okay, have because we are focused more on elderly, which have comorbid factor that increase their mortality rates, especially when they are infected with this COVID-19. Can someone explain to me how do you think that physiotherapy treatment do help in curing, in reducing their hospital admission. I mean, how does a physiotherapy intervention help patients to reduce their hospital admissions? Macam mana perawatan fisioterapi ni boleh mengurangkan dia punya apa? Dia punya apa kita panggil bahasa Melayu dia? Dia punya stay dalam hospital tu lebih lama. Macam mana?
Can I try?
Okay.
Hello. As we all know, sebab orang tua ni, as we all know, physio kan dia assist dalam kita punya respiratory rehab kan. Elderly memang tend to dapat risiko apa ni? Risiko COVID-19 ni dia mengganggu dia punya respiratory tract apa semua. So dengan physio with our respiratory rehabilitation, kita akan mempercepatkan lagi proses masalah yang terjadi dekat dia punya respiratory tu tadi. Contohlah dia ada kahak kan. Dia orang kan susah nak keluarkan kahak. So we help untuk membantu mengeluarkan lagi kahak tu tadi. Contoh dia macam tu. So the faster, lagi cepat kita bertindak, lagi cepat dan lagi mudah untuk benda tu hilang. I mean lagi cepat dan lagi mudah untuk kita dalam mengeluarkan benda-benda yang restrict dia, benda-benda yang obstruct dia punya airway tu tadi.
Okay, saya ada satu soalan, one question. Mostly about mostly apa yang you all present is about general physiotherapy intervention. For me. So kita dalam conference for geriatric kan. So from your reference also I see from Physiopedia, okay? Physiopedia mostly saya pernah baca lah. So is for intervention for general. So bukan specifically for geriatric part. So from my opinion, you all should add more intervention or some modification can be done for geriatric. Okay, specifically for geriatric. So kat sini saya tak berapa nampak. Saya tak tahu mungkin yang lain nampak ataupun judges lain nampak, saya tak sure. Tapi for me saya tak nampak, saya nampak as a general. And then more
Sorry for interrupt, sir. For your question, we have done a lot of research, by the way, but all of the research is more for patient with not the geriatric patient. Most of them is 18 to 40 plus to 20 plus patients. So maybe this is kelemahan, our lack in presentation and for our topic. But we have tried to search for the elderly management, but sangat-sangat rare and very less amount of research lah.
Yeah, that's why saya kata topik ni agak susah untuk specifically for geriatric. So it's mostly general intervention yang kita akan dapat. So that's why saya kata macam agak susah saya nak komen sebab dia tak specifically for geriatric. So in my opinion, you all should add some intervention, bukan kata from reference ataupun from journal ke apa. From your side opinion tu, you boleh put some modification ataupun yang lebih spesifik kepada geriatrik. Kalau you nak fokus kepada psychological part, mungkin you boleh fokus kepada how to implement the intervention that focus for psychological part. Specifically for geriatrik. So kat situ saya tak nampak. Right? For me. Okay. So itulah yang saya nampak kekurangan kat situ. Boleh ambil topik ni, tapi you can add on you punya opinion you sendiri as a speaker. You kena bagi some opinion dan do some modification lah based on apa yang you cari dalam journal. Memang takkan jumpa lah sebab dia it's a new thing kan. Alright, okay, thank you.
Okay, I would like to ask the judges if you guys want to continue or to take a 5.
We can continue if you want. If we continue, we can finish earlier lah.
For me, boleh continue, tak ada masalah.
Boleh?
Okay.
Ada judges?
Ada judges?
Okay. So, okay. Stay cool, everyone. Now, we will proceed with the group 4 with the title Roles of Exercise with Music in Preventing and Treating Depression in Elderly, supervised by Puan Normaliza. Please welcome group 4.
Okay. First thing first, I would like to say good morning, it's still morning, and thank you to our lecturers as also the judges for committing their time and commitment to our conference today, and also to my fellow brothers in arms. This also applies to women, of course. It's not just brothers in arms, it's just a figure of speech. And we, as the fourth group, will present about role of exercise with music in preventing and treating depression in elderly, supervised by Puan Mariza. I'm Wise, and my fellow group presenter, Zakira, Wahida, and Iza. Next slide. And that is the table of content, which you can see we are going to present that in a minor 20 short minutes. Okay, next. Next. Dangers of depression. The first one being from the top left is self-injury. Why self-injury? Because people with depression tend to do self-injury to make themselves feel numb, or even to distract themselves from being depressed, because the pain from the self-injury is either to express themselves through pain, or to, as I said, distract themselves from the being depression of the mental itself. And the second one being the weaken of the body function. Why weakening of the body function? Because depression in the long run can be a chronic stress, and thus making the blood vessels, so making the patient have a high blood pressure due to the long activated fight and flight sympathetic nervous system. That is because depression activates fight and flight, which is good in a short-term effect, such as for survival in instinct, is good. And then the third one being the relationship problems. If let's say a husband or even wife, children, or even their parents and friends have this kind of depression, then it will affect their relationship, because they will either get easily irritated or just get mad even at the smallest trivial matters. So that's the one of the relationship problem. And then addiction. Why addiction? Because people with depression tends to eat antidepressant. Either there is many antidepressant drugs, depends on what kind of depression causes. there's many hormones. This is the final way for depression people tend to do because they think that by death they can escape from their misery. Okay, next slide.
Okay, so what exactly is depression? Depression is defined as a common psychiatric disorder with symptoms including low mood, low energy, poor concentration, loss of pleasure, poor self-care, and low self-esteem. So statistically, in Malaysia, it is reported that the prevalence of depression among elderly range from 6.3 to 18%.
Okay, so these are symptoms of depression. First, feeling sad or having a depressed mood, loss of energy and increased fatigue, trouble in sleeping or we call insomnia, or sleeping too much, changes in appetite, difficulty in thinking, concentrating or making decisions, then poor in memory, increase in purposeless physical activity, loss of interest, feeling weightless or guilty, and last, thought of death or suicide. Okay, next. Okay, there are some of risk factor of that lead to depression. Okay, first is biochemistry. Okay, depression. Depression is one of the mood disorder that triggered when neurotransmitter in the brain out of balance. Neurotransmitters such as dopamine, serotonin, and norepinephrine, which help the brain to communicate with the part of the body. So when this neurotransmitter is in low level, so will cause a big effect to the part of the body. Okay, then the second one is genetic factor. Genetic factor, when one of the family member has depression, this can increase the risk of the others member to get the depression. In research study by American Psychiatric Association, state that if one identical twin is diagnosed with depression, then the other one has 70 chances to develop depression too. Alright, the third point is certain medical condition. The patient who have a chronic illness are more likely to experience symptom of depression. This because the brain and the body are linked together. So in this point, we will explain more on the next slide. Okay. Fourth point is personality. For personality, person with low self-esteem, low confidence level, and always overwhelmed with stress are more tendency to get depressed. Okay, last, environmental factor. Person who are living in continuous exposure to violence, neglect, abuse from their parent or from surrounding, from surrounding, other surrounding, may more vulnerable to get depression. Okay, next.
Okay, how does medical condition can lead to depression? First is drug or medication. Many are not aware that drug prescriptions can also associated with depression symptoms, such as medications such as corticosteroid, opioid, anticholinergics can sometimes cause changes and fluctuation in mood. Even blood pressure medications or beta blockers have been linked to depression. Second is chronic illness. So what's the link between depression and chronic illness? In some people, chronic illness causes depression. So chronic illness is an illness that lasts for a very long time and usually cannot be cured completely. People who have chronic illness will suffer from pain, which linger for weeks to months, which will disturb sleeps and other activities. Third is because of isolation. When patients suffer from medical condition like stroke, they don't have the ability to being in social or do other activities anymore. There will be relationship problem also, and this will lead to depression. And fourth is unable to work. So when suffering from medical condition, patients' productivity at work reduce. So they will feel worthless and guilty as their work is not as effectively as before. And then last but not least is imbalanced hormone. Imbalanced hormone is with the pain the patient have to suffer, they will get stressed. If the person has consistent uncontrolled stress, it will compromise the ability to produce and use their cortisol. If this happens, they will oftentimes get very fatigued and eventually depressed. Okay, next. So these are the medical conditions related to depression. First is stroke, and then heart disease, and then multiple sclerosis, HIV, last but not least is cancer.
Okay, so what is our role as a physiotherapist to treat elderly patients with depression? Okay, first we can give pain relief such as hot pack. Okay, for instance, heat increases skin and joint temperature, improve blood circulation, and give relaxation effect to our muscle. We can also give cold therapy as it is good in reducing the nerve conduction velocity, thus reducing the pain from the muscle and the blood vessel itself. As a person with depression may have high blood pressure due to the fact of the increased activation of fight and flight. Electrical stimulating currents, such as stance and interferential current, utilize electrical energy, the flow of electrons or other charged particles from one area to another, causing depolarization of muscle or nervous tissue. This will stimulate the A delta and C fibers to release endogenous opioids, resulting in prolonged activation of descending analgesic pathways. A meta-analysis in 2010 concluded that massage therapy or soft tissue manipulation may help to reduce depression and help older people to relax. Exercise improves mental health by reducing anxiety, depression, and negative mood, and by improving self-esteem and cognitive function. Exercise has also been found to alleviate symptoms such as low self-esteem and social withdrawal. Lastly, we can also educate our patient on relaxation techniques so they can do that at home by him or herself.
Okay, these are the evidence-based practice exercise for depression in older adults. First, research says that research in older adults have indicated specific exercise-induced physiological changes that may be related to a reduction in depressive symptoms. And then the second, recent research has revealed that physical exercise may be specifically helpful for older adults suffering from depression. This is because physical exercise promotes mobility, and older adults, elderly, tend to stay in one place for a very long time because they get easily fatigued when they start to do physical activity. So physical exercise help because they promote mobility in elderly. And then the third research compare between elderly who take antidepressant plus aerobic exercise and the elderly who takes antidepressant without aerobic exercise. So the results say that individuals receiving aerobic exercise plus antidepressant display greater improvement in cognition and autonomic balance compared to those only receiving antidepressant without aerobic exercise. Next.
How to make the exercise more fun and efficient? The answer is music, as stated in the slide. Okay, next. Okay, the evidence-based practice of effect of music on depression. Recent studies have shown that participants have a choice of choosing the music, and with a certain and appropriate music, suitable one for the patient with the depression, it will lower anxiety, promote relaxation, and finally lead to an effective treatment. The second one, the bottom, you can see that instrumental music therapy has been shown to promote cognitive recovery and mood improvement. How does this promote cognitive recovery? Because playing instrumental music is involving focus, attention. Now, this will make the hippocampus, which is the focus part for the attention, will give more attention to it, thus countering the effect of depression. And then it will also improving the mood improving the mood. Why? Because when we are given a full attention to the music instrumental, we would play it wonderfully, given that the person know how to play the instrumental music therapy, of course. And then the top right corner is a music therapy has a positive influence on the mood of patient after stroke. When music is played, all areas related to the limbic system is stimulated to produce feelings and expression. Limbic system is a whole part of big organs, and one of the two is amygdala and hippocampus. Both of them plays an important role in emotion and memory. So if the music is played, the limbic system will process the music and store it in efficient method. Okay, limbic system, right? There's a reward motivation addiction because of the release of dopamine, because of the feelings of the song that have been played. And then there is also an emotional response, which will go to the next slide, and then fight flight, and then a memory, and so on. Okay, the next one, music eliminates a negative feeling and lead to physical and mental. Not yet. Not yet. Passion. Eliminate negative feeling and lead to physical and mental relaxation in individuals with depression. How does music eliminate negative feelings? Is by the elements in music itself, such as harmony, pitch, and so on, that has been used to create music, and frequency also. By correct frequency and so on to the specific individual, it will countering the effect of symptoms of depression, such as lower mood, sad hopelessness, because song and music will also develop lyrics that is implemented in the song. So by reading those lyrics, and some of them have a music video which will protect about the song and lyrics and the meaning of that song itself. So it will countering the effect of the depression itself. Next. Okay, how can depression be reduced through music? And the first one is affecting human psychological response. This is going to psychological response is, as I said before, is the limbic system itself processing the music and keeping it in the memory with an emotional that is suitable with that song on that same situation when he hear it for the first time. And then the second one is a wide range of emotional responses. An example given, a man would propose to a woman, and then the background music for that proposal is wise man said, only fools rush in, 'cause I can't help falling in love with you. Example, that song being played. Then, of course, it will elicit a wide range of emotional responses. To the woman, it will bring a burst of tears of joy, and to the man, oh my God, finally, the woman received me as a future partner, and so on. And the third one, music calls on memory of the past experience. One day, let's say in their 50, the man and woman before that I told you, and their 50, they listen back to their proposal song, which will bring back those time where the boy man, the man proposed to the woman. So it will bring back the joys and the happiness again. Okay, that's why the music calls on memory of the past. And then music produces the psychological response of altered mood leading to improved health. So example given, if a sick person were to given a listening of a favorite song, her or his, and then he or her will definitely feel a slightly better mood because of what the song trying to the Malay word sampaikan. Sorry, And going to the next one as layperson. As layperson, use temporal loop to process music. Okay, who is layperson? It is us, the consumer, the listener, and not the one who created the music. As the layperson, we use the temporal lobe to process the music, but the one who created the music, they will use their occipital lobe. And then the one that plays the important part is the nucleus accumbens, which music will cause at the nucleus accumbens play as release addictive feeling like it's a drug. It's similar according to Sogaya, you can search as mentioned below, and then therapeutic outcome, reduce symptom of depression, which I have all mentioned before. Next one.
Okay, so next. Okay, how we preventing and treating depression, we use aerobic exercise plus relaxing music. Okay, so this how to conduct aerobic exercise for elderly. Okay, first use relax, slow and classical music. Provide chair for every patient because we will do this exercise in sitting position. Third, start with breathing exercise, which can improve the blood circulation and improve and increase the energy level. Then warming up, prepare the body for, before start the exercise. Then cooling down. Lastly, breathing exercise. So these so there are some precaution for elderly before we go to exercise, during exercise, and after exercise. Okay, next. Alright, so these are the example of aerobic exercise that we can do for elderly. Okay, first is overhead bend and reach. Second, shoulder blade and squeeze, shoulder blade squeeze. Third, knee to chest. Fourth, seated forward bend. Marching in place and sit forward bend. Okay, so we provide a video, the example how to do aerobic exercise plus with
Kick your
music.
feet forward. Kick. Kick.
In sitting position.
Double kick now with the right leg. Here. Two. Another leg. Two. Two. Kick it out. Other leg. Lift. Kick. Lift. Kick. Lift. Kick. Let's try it again. Lift. Kick. All right. Lift. Kick. Lift. Kick. Lift. Kick it out.
As the conclusion, you can see that we have presented music and exercise does bring positivity to the reduction of depression and ultimately the musculoskeletal muscle itself backed by previous numerous researches that we have presented. Thank you for listening.
Good job, Group 4. Thank you for sharing. So now we open for the Q&A session. Is there any question from the judges?
All right.
Okay.
Thank you to all the speakers, especially for the energetic speakers one. Okay. All right. Music. So music for elderly. Okay. Mostly untuk elderly music more on group exercise, right? So Okay, more on group exercise elderly.
Yes.
So, is there any music base for individual exercise for elderly?
Okay, I'm going to answer that. Okay. Okay, saya jawab dalam bahasa Melayu lah. Sebab to elakkan language barrier. Okay, kalau mengikut pertanyaan Sebat tadi, dia muzik ni tak specifically cater to each individual of depression lah, sebab each individual of depression ni dia ada berpunca daripada apa yang kurang hormon dalam otak dia lah, neurotransmitter. Ada yang kurang dopamin, ada yang kurang serotonin, which akan efek lain lah. Kalau lagu tu efek secara lain, contoh kita orang Asia suka lagu balada, contoh. Dan kemudian orang Amerika suka lagu yang kepada rap ataupun electronic dance music lah. Jadi setiap lagu tu dia tidak samalah pada setiap orang. Dia berbeza. Ada yang macam katakan yang boleh tidur dengan lagu rock. Ada yang katakan lagu shooting pun tak boleh tidur. Dia macam tu lah. Jadi dia tak ada specifically kata lah, each one is different lah. Walaupun orang yang sama akan datang pada masa akan datang with remission of depression lah. Doesn't mean yang perubatan yang pernah kita buat tu, muzik yang sama, cara yang sama tu akan memberi hasil. Sebab dia mungkin berbeza. Okay. Harap itu dapat menjawablah persoalan Sebat.
So how you identify for certain geriatric patient, okay, sure. Okay, dia memang perlu in term of music therapy. So how you identify in term of what?
Macam kalau saya jawab sekali lagi, lupa nak beritahu. Kita boleh macam salah satu percubaan trial and error lah perubatan. Katakan dia suka muzik, kita tanyalah dia dalam keadaan sopia kan, kita tanya dia, Encik ada suka muzik ke? Macam mana yang Encik suka? Sebab belum tentu pesakit yang kita jumpa ni orang yang menyukai muzik. Ada juga orang yang tak boleh dengar muzik, dia akan rasa pening. Dia akan rasa pening, irritated sebab depression kan. Sebab lagipun kita boleh tengok kalau macam nak tahu dia depression, macam ada simptom tu kan. Boleh dia akan slouch back, dia akan sentiasa pandang bawah, hopelessness, lack of eye contact. Jadi macam tu lah. Boleh tak menjawab ke soalan Sebat?
Boleh. Right. Thank you.
Sama saya.
Okay, group ni group keempat Okay, group keempat, Tanya. Very interesting topic. Saya ada, pertamanya saya nak highlight satu benda. Music ni memang boleh reduce depression. Okay, tapi music juga boleh induce depression. So macam cikgu cakap tu, the choice of music yang awak pilih memang perlu sesuai. Okay, saya cuma nak tanya, ada any inclusion criteria for this type of program? Did you include any inclusion criteria for this type of program? What kind of patient that is suitable? What kind of older adult that is suitable with this type of exercise? And then, apa satu lagi? Boleh jawab yang tu dulu lah. Ada satu lagi saya tak ingat.
Okay, baik. Maaf kalau saya ni terlalu banyak jawab soalan. Okay. Kalau untuk persoalan Puan tadi, untuk kriteria bagi music therapy ni, dia cuma macam yang menghalang pada exercise lah, sebab music therapy ni yang macam ada video tadi kita includekan sekali dengan exercise. Kalau semata-mata untuk rawat depression, boleh katakan semualah kecuali mereka yang memang tak boleh dengar muzik, yang ada irritated ataupun peka. Lah. Jadi kedua, yang kalau perlu ada kriteria, mereka yang boleh masuk muzik dan exercise ni ialah yang tak ada contraindication macam sakit jantung yang kronik lah, unstable angina, baru buat pembedahan jantung, cardiovascular, dan semua yang melibatkan tu lah, dengan attention deficit apa semua, Alzheimer dia boleh buat tapi dalam keadaan yang macam better one lah. sebab kita perlu coachingkan daripada secara grup, kita susah nak kontrol. Harap dapat menjawab persoalan puan.
Okay. Jadi what type of music yang awak nak gunakan to passion with this? Bila awak letakkan satu music as a untuk reduce depression kan, bila awak buat group terapi tu awak mesti ada satu kriteria yang sama untuk setiap patient. Okay, cuma saya nak kata kat sini awak patient tu boleh actively move and then dia punya problem lain. Okay, sebab yang ni awak fokus more on depression kan. So patient punya physical activity dia, physical disability dia macam mana. Itu yang sebab kita as a physiotherapist, yes, kita akan fokus more on dia punya physical activity. Plus kita boleh ikutlah kan ada way untuk saya cuma nak awak pergi fokus more on apa dia punya physical disability yang mungkin oleh adult yang lead to depression ni, yang awak rasa sesuai untuk awak buat music therapy.
Baik. Jadi puan menanyakan tentang physical disability yang boleh dilaksanakan lah dengan music dengan exercise ni. Bagi jawapan dia boleh menjadi usually lah musculoskeletal problem lah, macam muscle atrophy ataupun keketatan otot lah. Biasa macam tadi kalau kita tengok dalam video tadi, dia cuma angkat kaki macam tu je. Boleh juga dia exercise untuk just probably better circulation throughout the whole body lah. Katakan dia ada masalah high blood pressure apa, ketidaklancaran darah ataupun back pain ataupun dystrophy of the hip muscle, tight muscle, gastroc muscle. Jadi dia boleh jadi macam-macam sambil duduk tu. Boleh juga kalau nak buat sambil pegang stick tu kan, buat gerakan gitu. InsyaAllah lah harap dapat menjawab soalan puan.
Okay, saya dah tak fokus Okay, apa sebenarnya masalah adult yang mungkin lead to depression?
Okay. Jadi apa masalah sebenar adult ni lah yang lead to depression. Dia boleh jadi, okay puan saya jawab. Maaf saya salah tadi.
Saya rasa ahli kemahiran lain pun boleh juga membantu Wise untuk menjawab.
Saya tak nak one man show in each group, so saya tak nak macam tu. Okay, so saya prefer orang lain yang boleh menjawab jugalah.
Okay, saya jawab. Okay, boleh ya? Okay, untuk persoalan puan, apa medical condition yang boleh menyebabkan depression? Apa dia?
Medical condition. Misalnya apa yang boleh lead to depression among adult ni?
Apa yang akan lead older adult ni untuk dapat depression? Okay, so mostly older adult ni kalau kita tengok mungkin ada yang mempunyai masalah daripada masalah penyakit sendiri, ada yang depressed disebabkan oleh persekitaran dia sendiri. Okay, so banyak faktor yang menyebabkan older adult ni boleh lead to depression. Macam yang kita tengok tadi, bahagian risk of factor kadang boleh disebabkan biochemistry, kadang boleh disebabkan personality tu sendiri. Kadang sebab setiap manusia ni personality dia lain-lain. Ada yang jenis kurang confident, memang daripada kecil dia macam ada anxiety. So benda-benda tu bila dia makin besar dia akan lead kepada depression.
Boleh saya jawab?
Boleh.
Contoh condition yang selalu elderly ada macam specific back pain ataupun knee pain. So because of the conditions, they cannot do the activities they once did. Macam tu. So dah tak boleh, they cannot go out anymore. They isolate from social activities. And then dah tak boleh pergi masjid. Macam tu lah. So that's the specific condition that's suitable
we can do for group exercise ni untuk music.
Okay, very good answer. Thank you very much. Once again, Tanya. Saya dah tak ada apa-apa. Cik Bat.
Tahniah saya ucapkan untuk presentation yang energetic. Tapi make sure the whole team kena energetic lah, bukanlah certain person saja kan. Okay, alright. Thank you.
Thank you for all. Okay, last but not least, I would like to invite Group 5 with their title New Generation Intervention in Control Dementia Symptom, which is Robot Pet Therapy, supervised by Puan Nani Nazrin. Please welcome.
Nampak slide Okay. Assalamualaikum. Boleh dengar ke?
Macam dengar echo, saya tak tahu kenapa. Echo.
Okay. Sorry tadi. Okay, Assalamualaikum and a very good morning to all the honorable judges, lecturers, and to all my fellow friends. First of all, I would like to introduce my team members, which is the first one is Angelis James, second is Felicia Tarika, third Fitri Shamina binti Pawallah, and the fourth one is me myself, Muhammad Irfan Syafiq bin Wahid as the first speaker, and the last one is Umi Syahidah binti Muhammad Fauzi as the second speaker. And I'm also particularly grateful for the assistance given by Puan Nani Nazrin as our supervisor. Before we go deeper to the main topic today, which is the robot pet therapy, let's go through what is the dementia itself. So I will pass the speaker to Umi Syahidah to explain more about the dementia. Hope you guys enjoy the presentation.
Okay, thank you, Irfan. Hello and good morning to all lecturers and my fellow friends. Okay, so let's start with definition. Next, okay. Okay, according to World Health Organization 2020, dementia is a syndrome usually of a chronic or progressive nature in which there is deterioration in cognitive function, emotional control, social behavior, or motivation. For example, it affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment beyond what might be expected from normal aging. Okay, next.
Irfan. Please mute.
Ya. Pak saya
Okay.
Sikit lah. Ya.
Okay, for clinically relevant anatomy, symptoms of dementia depend on the area of the brain that affected. The hippocampus, though, is often involved and contributes to the well-known symptom of memory loss. Okay, so what is hippocampus? Hippocampus is center of memory and learning. According to Maruzak A and Tura S 2018 state that cells in this region are normally first to be damaged in Alzheimer's disease and resulting in common symptom of memory loss. And then Heiger at T et al. 2018 stated that reduction in hippocampal volume are seen in common patterns of aging but are exacerbated in Alzheimer's. Okay, next. Next. Ipang next. Okay, for the epidemiology, according to World Health Organization 2020, worldwide around 50 million people have dementia, and there are only 10 million new cases every year. Alzheimer's disease is the most common form of dementia and may contribute to 16 to 70% of cases. And the Alzheimer's Association state that just over a tenth of people and age 65 years and more have Alzheimer's disease. This proportion rises to about a third of people aged 85 and older. Alzheimer's account for 60 to 80% of all cases of dementia. And others, an analysis of the most recent census estimate that 4.7 million people aged 65 years and older in the United States are living with Alzheimer's disease in 2010. According to Rees et al. 2006 and Tay et al. 2016, the prevalence of dementia in Malaysia is estimated at 0.126% and 0.454% in 2020 and 2050 respectively. Okay, next for etiology. For etiology, next slide. Okay, for etiology, there are several causes that can lead to dementia. For the first one is etiology, Pang. Okay, for etiology, first one is infection and immune disorder. It can result from fever or side effect of our body's fight off an infection. For example, multiple sclerosis and other conditions caused by body's immune attack nerve cells also can lead to the dementia. Semua nampak ke slide?
Nampak.
Okay. For the second one is metabolic problems and endocrine abnormalities, which is this a case common in people with thyroid problem, low blood sugar or hypoglycemia, too much or too low sodium and calcium, and also for those who have problem absorbing vitamin B12. Next is nutritional deficiencies. This for those who have a dehydration problem and do not get enough vitamin B1, B6, and B12. Also for those that have deficiencies in copper and vitamin E. And this condition is common with people who had chronic alcoholism. Next is medication side effect. Okay, this due to reaction of medication that elderly consume. And the fifth one is subdural hematomas. Common in elderly after fall, which is they are bleeding between the surface of the brain and it covering the brain. And next is poisoning, which is for those who are exposed to heavy metals such as lead, recreational drug, and also having a heavy alcohol. And the last one is nausea and also called as hypoxia, which is not getting enough oxygen to the tissue of the organ. And this condition due to severe sleep apnea, heart attack, and carbon monoxide poisoning. Okay, next. Okay, for pathophysiology, there are no specific pathophysiology to dementia, but there are few diseases that can lead to the dementia. The first one and the common one is Alzheimer's disease, which is happen when there are accumulation of protein beta amyloid plaques in the brain, and the amyloid structures produce adverse effect that can cause cell death. Okay, for the second disease is Parkinson disease. Okay, Parkinson disease occur when there are Parkinson disease occur when there are build-up of proteins in the brain or Lewy bodies, which can cause cell death. This will tend together in the basal ganglia, the substantia nigra, as well as the thalamus and cortex, and causes the reduction of dopamine and lead to the Parkinson disease. The third one is stroke or vascular dementia, which is it happen when there are inadequate blood flow is provided to the brain or specifically to the hippocampus and causing the cell death. Okay, next slide. Okay, next slide. Next is chronic traumatic encephalopathy or CTE, which is occur when there are repeated head injuries and common in athletes and causes of brain degeneration. And the last one is Wernicke-Korsakoff syndrome or alcohol-related dementia, which is this from a rise of malnutrition and alcoholism, deficiencies of thiamine or vitamin B1, and the brain cells do not have the adequate fuel to perform tasks. And this will lead to Wernicke-Korsakoff syndrome or WKS. Next slide. Okay, for clinical feature is memory problems. They will have reduce of concentration. They will increasing confusion and also personality changes from before, and they also may have a depression. Okay, next for doctor management. Next slide. Okay, for the next slide, for the next is doctor management, which is the common management from doctor is medication, and there are few medication that doctor will given. First one is antidepressant for reduce depression, and then antipsychotic to regulate functional of brain of control of thinking, mood, and perception, and then hypnotics for patients that have insomnia problem. Anxiety for reduce anxiety symptom, and then anticonvulsants to prevent epileptic seizure, and the last one is specifically for dementia patient, which is cholinesterase inhibitor to reduce dementia symptom. And there are few therapy the doctor will given to the patient. For example, is cognitive stimulation therapy, which is this therapy will be doing in group. And this is for improve mental abilities and memory of the patient. And then reminiscence therapy. This therapy will use all of our sense we have, for example, sight, smell, touch. Okay, and this therapy is help individual with dementia to remember events, people, and picture in a past life. And also, doctor will give advice for regular exercise and healthy lifestyle. And the last one is robot pet therapy. Okay, next. Okay, for physiotherapy management, as a physiotherapy, we can give them active range of motion to keep muscles strong and flexible so that patient can do functional activity easier. And second one is practicing functional tasks to enhance independence so that patient can do activity by themselves, not 100% depend on carer. And then advice on mobility aids or equipment for home to ensure safety and promote mobility and functional. And then we can give them get re-education with or without support according to patient condition to support to maximize their mobility. And the last one is balance training to improve confidence and reduce risk of falling. Okay, next I pass to Irfan.
Sorry guys, sorry for the technical problem. So guys, let's continue our presentation. So today, here the main topic today, which is the new intervention for dementia patient to reduce the symptom like anxiety and depression, which is the robot pet therapy. So let's go to the introduction first. So the PARO, which is the short term for personal robot in the Japanese language. PARO has been designed by Takanori Shibata for the from the Intelligence System Research Institute of Japan, which is ACE, in 2004. And this robot already got approval from FDA and was classified as a Class 2 medical device by US regulators in fall 2009. This PARO can imitate animal behavior but also responds to light, sound, temperature, touch, and posture. And over time, due to its artificial intelligence capability or AI capability, it also can develop its own character. So PARO or personal robot promote the therapeutic result of psychological, physiological, and social effort from those who interact with it. It also can reduce or lowering stress, improving depression, and reducing anxiety in many cases. So despite the fact that animal-assisted therapy has been used for many years, some senior healthcare settings still do not accept it, even though they acknowledge the positive benefit of animal-assisted therapy and activities involving therapy pet. So, according to the B. Joseph C. and Fisher G. in 2005, they said that many are concerned regarding the negative effect to human, which is the pet therapy give negative effect to human, such as allergies, infection, biting, scratching, or even fear of the animals involved in therapy. So, according to Johnston in 2015, he stated that the PARO has been used primarily in care facilities, especially as a form of therapy for dementia patients. So, in Malaysia, there is a study conducted by Shamimi Samsudin in 2018. So, for your guys' information, this study actually was the first study in Malaysia that introducing PARO to the Malaysian people. Statistically, analysis was conducted with total of 120 respondents using dataset, and the result is 95.8% response agreed that PARO able to make them calm. Both adult and children dislike PARO with the percentage less than 5%. So from this study also, they suggest that half an hour was the chosen for the best time to spend with PARO. And then here some pictures you can see here. The above picture is the original PARO seal, which is the animal has been designed by Takanori Shibata. It was a seal, and you can see there. You can see that. Oh, sorry. Okay, sorry. So you can see there's a CPU and voice recognition, learning function. It also has touch, posture sensor, light sensor, and microphone. All of the sensor make this robot pet really intelligent. So the down below, it was a picture of a paro cat, which is another design of the paro, which is a cat. And nowadays, there are also a lot of another animal design, such as dog, and another animal that can meet the patient preference. So from the robot pet therapy, the implication from the robot pet therapy, it can reduce the medication cost because an average of individual in the senior living environment consume an average 16 to 28 medication per day at an average cost of 1,200 to 1,500 US dollar per month, which is quite expensive. Which is when we convert it into ringgit Malaysia, it's about 6,000. Okay, they spend 6,000 plus ringgit Malaysia only for the medication. It's quite expensive. So the second one is the intervention with the paro robotic pet was 3 times weekly for 20 minutes significantly can reduce the need for this medication. Okay, so it also can reduce the risk of getting complication from the medication, which is this is the one of the giant that have we learned in the geriatric, which is iatrogenesis, which is getting complication from the medication. So according to the Gary P. et al. 2014, this medication can cause or worsen heart arrhythmias in the older adult and worsen other chronic conditions such as renal impairment or GI distress and liver impairment. So this is the clinical practice by S. Peterson et al. In 2016. So the purpose of this study was to assess the effectiveness of paro-robotic pet therapy in the treating dementia-related symptoms such as anxiety and depression. So how the methodology has been done in this research, there will be 2 groups, which is experimental group that will receive pet therapy, and the comparison group will receive the standard of care like relaxation therapy, physical therapy, music therapy, and so on. So the experimental group participants were exposed to treatment with a paro-robotic pet once a day for 3 days a week. Each session lasts 20 minutes and sessions continue for 3 months. The 20-minute session involved sitting of 6 residents at the round table, placing the paro-robotic pet in the center of the table, and encouraging the resident to interact with the robotic pet by demonstrating the interaction. So the outcome measure has been used in this study are rating for anxiety in dementia, RAID, Gallner scale for depression in dementia, which is CSDD, global deterioration scale, GDS, pulse rate, pulse oximetry, galvanic skin response, GSR, and medical utilization. RAID, CSDD, and GDS only will be taken before and after 3-month treatment, while pulse rate, pulse oximetry, and GSR will be taken along the treatment. So all of these outcome measure has been used because it has a higher validity and reliability. So here's the outcome measure that you can see, RAD, CSDD, and GDS, pulse oximetry, and galvanic skin response, GSR. So the result from this study is 61 patients with 77% females, average 83.4 years in age, were randomized into control and treatment groups compared to the control group. So RAID, CSDD, GSR, and pulse oximetry were increased in the treatment group, while pulse rate, pain medication, and psychoactive medication use were decreased. It was a positive result. So the discussion from this study, using the data from the 3-month study, researchers found that intervention with the paro-robotic pet provide a viable alternative for controlling symptoms of anxiety and depression in elderly patients with dementia, often in lieu of pharmacological modalities. Oxygen saturation, pulse rate, GSV, RAID, CSDD, and medication use were all positively impacted in patients participating in the interventional group, indicating the improvement of the symptom control. So the conclusion is, it's likely that treatment with the paro, which can decrease stress and anxiety, it also can be effective in controlling or assisting in the relief of chronic pain. So we hope that Malaysia will use this Sparo therapy as primarily in care facility soon, because Malaysia doesn't well known yet for the robot pet therapy. Maybe because it's quite one of the personal robot quite expensive. The price is about $6,000 for one robot. So when converted to Malaysia ringgit Malaysia, it can estimately can reach about 20,000 plus for one robot. So it's quite expensive. So here's some video for you guys to see how the robot pet therapy has been done. So here are they charge the robot. Okay, so from the video we can see how the elderly interact with the robot pet therapy, and some of them give positive feedback from the robot pet therapy. Give them a positive effect from his emotion, their emotion. So it's quite good. So that's all from us. This is the reference. Thank you. Sorry for the technical problems.
Thank you from the group 5. Now I open the Q&A session from the judges.
Okay, thank you for the speakers. Great presentation. However, with some technical error and not really good in video presentation, but it's okay. All right. I just want to ask one question. How about the role of physiotherapy towards the use of this robot technique? The role of physiotherapy in this intervention.
Actually, there is no latest intervention, physiotherapy intervention for the dementia. It's normally a common intervention only that we found here. So this robot pet therapy actually medical management from psychotherapists. It's not really from physiotherapy, because physiotherapy management is only for the physically. So there is no latest or recent intervention for the dementia. So we only focusing on for the doctor management, which is robot pet therapy. Robot pet therapy is actually under psychotherapy, not under physiotherapy. But if a physio have budget or extra budget to buy this one robot pet, it also can be used in the department.
What I mean is the role of physiotherapy from your opinion.
Oh,
Okay,
from my
yeah.
Maksudnya untuk apa yang berkenaan dengan robot pet terapi tu ke tak ada kena-mena?
Yang berkenaan dengan robot pet therapy, mungkin you boleh contribute some intervention bersama dengan robot tu for your opinion lah.
Oh, kita kan ada macam relaxation technique kan. So relaxation technique tu kita boleh masukkan robot pet therapy ni sebagai one of the intervention lah. Okay, sebab robot pet therapy ni dia boleh reduce depression dengan anxiety. So one of the relaxation technique lah. Kalau macam dekat department tu ada budget lebih ke, boleh beli satu robot ni untuk sebagai one of the intervention lah untuk treat dementia. Other than bagi normal punya normal punya treatment lah.
Okay, thank you.
Yes, sorry saya nak confirm semula. Tajuk asal grup ni ialah dementia kan?
Yes.
Okay, so yang evidence base awak cerita tadi dia contribute kepada dementia ke tak?
Dementia, dia memang robot pet therapy ni memang dia fokus untuk dementia patient yang ada masalah anxiety dengan depression. So ni ada dia punya clinical practice ni dia buat dekat dementia patient lah.
Sebab daripada tadi awak asyik sebut pasal depression, stress, depression. Okay. Tapi kita nak lebih fokus pada more on dementia. Kan?
Actually robot ni memang dia punya khas adalah tujuan untuk dementia patient lah. Kalau ikut dia punya study.
Related symptoms such as anxiety and depression. Okay. Saya sebenarnya yang Cik Bat tadi, saya refresh balik soalan Cik Bat tadi. Macam mana awak gunakan robotic pet therapy ni untuk treatment awak sendiri? Itu yang Cik Bat tanya tadi sebenarnya.
Yalah, as a physiotherapist kan. So kita tak nak bidang lain. Kita nak cerita pasal physiotherapist. Apa kegunaan kita kat situ?
Kegunaan kita sebab ni dia macam lebih kepada robot yang buat kerja. Jadi kita cuma macam monitor je lah macam mana dia orang interact dengan robot ni. Sebab cara dia macam ambil patient 4 orang kan, 6 orang duduk dekat sekeliling meja. Lepas tu letak satu robot kat tengah tu ataupun 2-3 robot. Lepas tu diorang akan interact dalam masa 20 minit. So actually dia daripada physio dia tak ada macam contribute mana lah kalau dalam bagi terapi ni.
Kalau physio tak contribute, Irfan, sekarang ni awak as a physiotherapist, you choose this topic, robotic pet therapy. So you want to use this as one of your additional therapy.
Additional method therapy.
Yes, awak add on dalam awak punya terapi sendiri.
Saya cuba boleh?
Group member, yes.
Macam kita punya pet therapy ni, dia more to relaxation kan. Okay, untuk patient dementia, mostly dia orang maybe ada yang ada behavior changes ataupun bila kita nak buat exercise, dia akan agresif. So kita gunakan pet therapy ni untuk tenangkan dia orang dulu, bagi dia relax, and then bila dia orang dah okay, kita boleh proceed to our exercise lah.
Okay, that's a good answer. Boleh. Okey, kegunaan dia kegunaan dia sendiri as awak nak gunakan dalam awak punya terapi. Tu je lah kot saya. Okey, itu sajalah. Saya pun tak ada nak tanya lanjut. Terima kasih dan tahniah.
Okay, terima kasih Tania.
Terima kasih. Sebab ada masalah teknikal tadi. Tidak dijangka-jangka terjadinya begitu.
Cuma bagi saya, pendapat saya, role of physiotherapy tu tak nampak dekat situ. Okay. Kurang nampak kat situ. Okay, thank you.
Good job, and it is interesting. Okay, now I hope all of you enjoy with this virtual conference. And before we end our virtual geriatric conference, I hope the judges can give any conclusion or feedback.
Sekarang ke conclusion? Okay, boleh bagi judges take fast sekejap.
Okay, boleh.
Mungkin boleh
I think
bagi
we
another lecturer bagi some feedback. Saya nak bagi markah kejap.
Okay,
Okay, boleh.
boleh. So any lecturers to
Congratulations to all presenter.
Thank you, Puan.
Congratulations to the supervisor. Tapi saya ada sedikit, I got one comment here regarding today webinar, which I think not really impressive at all. No. Looking at your presentation today, I think you all taking too much lazy bum, doing job that not really impressive, and your presentation today for me doesn't. I don't feel anything. I don't feel anything. And I don't get any knowledge from this presentation. I'm sorry to say this to you, all of you. And I hope you guys can put more motivation, more what? More encouragement, more support to produce more. I think to produce proper presentation. It look like laid back, taking advantage. I'm sorry for these negative comments.
And I hope you guys can, I don't know, put more effort, please. Please give more effort. Jangan fikir that you're doing webinar and if comparing with your senior before this, when they're doing their conference, they give their 100% effort. But from this group, I don't feel anything. I cannot feel your effort and I don't know why. So can anybody answer me why I don't feel that effort?
Probably it's because the first time we are doing an online conference, and then not all of us are exposed to a good internet line. And then, sorry to say, I also have no experience in doing this and managing this. And then another thing about the content, uh, when we got the title right, our each group usually have, like, the title is COVID-19, stroke, dementia, just something like that. And then as throughout time, as we progress throughout the day, throughout the week, throughout the whole last month, the title keep changing as we discuss with our lecturer, and then add it up with online assignment, online class, and even we have like plenty of things to do here to manage our posting, and then probably our flaws and um, our incompetency. Just to be honest, I'm not experienced in doing all of this, but uh, actually we also didn't expect it to be live streamed in YouTube today. Um, uh, because at first it was planned like to be just uh, um, among us and everything, just a brief, the way we do the presentation. um, we didn't have a proper uh, clearer plan as we do. Plus sorry, line problem.
Okay. Saya buat tambahan sikit lah in term of comment kan. Okay, yang certain group tak bagi tak menunjukkan effort yang sepatutnya lah. Okay, mostly kebanyakannya group yang tak menunjukkan komitmen yang sebaik mungkin in term of how do you answer the question. Kena ada, dia tak boleh nak satu group kita akan pick 2%, macam tu tak boleh. So kena ada, sebab kena ada teamwork lah dalam satu group. Itu komen yang saya nak kena bagilah for all the group. Second one is dari segi penggunaan teknologi, supposed to be you kena banyak menggunakan video, you kena banyak menggunakan some animation for make it more interesting. Okay, and then from this virtual conference, it should be more macam more preparation dari segi, for example dari segi kita nak break ke apa ke, it should be bukan tanya as judges. Macam kita dalam one event supposed to be ada break, so mungkin ada you boleh show some video ke apa-apa sahaja yang within that break macam tu. So supposed to be kena macam tu. You kena anggap this virtual conference as a real conference. So kena ada dari segi penyampaian, dari segi pakaian, exactly pakaian pun kena main peranan. Sebab saya tengok ada yang berpakai t-shirt, ada yang agak tak proper. Saya tak tahu situasi di rumah, mungkin certain di rumah tu mungkin ada gangguan dari segi bunyi-bunyi, so mungkin boleh bagi tahu ke family members yang you bukan ada simple ataupun yang normal class, tapi you ada virtual conference yang di mana yang you perlukan tempat yang sesuai. Kalau ada tak ada tempat yang sesuai pun, kalau ada orang ramai sekeliling, mungkin boleh minta dia orang senyap, sebab you ada satu benda yang lain penting. Kalau saya rasa ini adalah satu kelas lain, dia punya expectation saya rasa ini adalah conference, so it should be more preparation from you guys dari segi nak manage lah. Alright, and then nanti mungkin Puan Cik Izzah akan bagi some link daripada Geriatric Conference yang dijalankan di JB, dan you boleh tengok daripada dia punya tu, dia punya YouTube live tu, bukan YouTube live dia akan recorded juga nanti, kemudian you tengok pun boleh. So macam mana dia orang implement dia punya conference tu macam mana, so nampak lagi well organised lah. Alright, so mungkin ini kali pertama bab yang cara tu, mungkin kali pertama. Untuk next punya ni mungkin kita boleh ambil maklum, at the same time ini adalah recorded, YouTube record, live and recorded, so kita boleh ambil ni sebagai satu improvement untuk next semester lah, for semester 4 yang sekarang. Alright, okay, thank you and congratulations to all of you. Right. For Siti Khadijah, any last comment?
Okay, semua tahniah dan terima kasih atas semua usaha awak semua. Cuma saya rasa good effort lah kan. Cuma ni adalah pertama kali. Cuma kita boleh perbaiki lagi pada masa akan datang. Dan lebih fokus lah. Saya harap lebih fokus setiap kali apa yang awak nak bentangkan tu, awak lebih fokus kepada tajuk yang awak nak bentangkan. Okay, itu sahaja. Tahniah dan selamat berklinikal lah.
I, as a representative of our batch, would like to thank all the judges, group supervisors, audience, and all the viewers. I would like to also to thank all those involved in making this virtual conference a success. I would like to apologize if there are any mistake that occur without being noticed from our batch. We apologize if there are any shortcoming. I would like to say that I hope in the future we can make another virtual conference like this. And of course, it's been improved. So that's all from us till we meet again next time. And for our batch, good luck for your clinicals next week.
Okay.
Bye. Thank you, Puan. Thank you, sir.
Okay, thank you. Bye.
Terima kasih. Thank you, Puan. Thank you, sir.
Thank you, Puan. Thank you, sir.
Assalamualaikum.